This study is really unique in the United States and the world because it covers such a large population and is one of the first to address infection rates in pregnancy. We studied infection rates in pregnant patients in Washington state, and we found a 70% higher SARS-CoV-2 infection rate in pregnancy compared to similarly aged adults. And even when we controlled for infections that might have been discovered that were asymptomatic at the time of delivery, the infection rate was still higher. We were really surprised that of the COVID-19 cases in Washington state in 20 to 39-year-olds, 10% were from pregnant women. A lot of pregnant women are involved in their jobs as frontline and essential workers, either in healthcare, in education, in agriculture, and in service jobs that might have put them at risk for acquiring a SARS-CoV-2 infection. They also may have larger households, children in daycare and in playgroups, and they may be caregivers for an extended family. Pregnant women from minority race and ethnic groups were disproportionately affected by COVID-19 in Washington state, with greatest disparities for Hispanic, American Indian, Alaskan Native, and Black race and ethnic groups. We also found that of the women with a COVID-19 infection in Washington state, 30% preferred a non-English language to be used during their medical care. And this says to us that in matters of public health policy, non-English speakers should be really prioritized for information at the beginning of the pandemic. What this data means is that pregnant patients were not protected during the pandemic. They were at risk for COVID-19, and their infection rates, if anything, were higher than in non-pregnant adults. The idea that pregnant women were not at risk from COVID-19 is a myth. And this means to us that the exclusion of pregnant patients from vaccine trials was a mistake. And although we will soon have more information regarding the risks of COVID-19 vaccination in pregnant healthcare workers that are being vaccinated now, we should have known this before. We want to use information from this study to be more prepared for the next pandemic and to not brush pregnant women to the side. They need to have a seat at the table when it comes to vaccine trials.